then it compresses, right? It compresses these couple upper ribs here. Yeah, no, seriously. Oh, hey there, this is Dr. Evan Osar. Happy Tuesday. Just hanging out with my buddy Bucky here. We're talking about shoulder mobility. Bucky's got some shoulder tightness. Many of your clients have shoulder tightness. Oftentimes, it's because of the cues that you and I have been taught to teach our clients, specifically to squeeze your shoulder blades down and back. Here's why that's not a great cue for a lot of your clients. Because there's a little tiny muscle underneath your clavicle. So underneath the collarbone here. And if you look at the clavicle here, you can see, I'm going to bring Bucky a little bit closer. You can see how there's a curvature to the clavicle. The muscle that sits underneath here is the subclavius. Sub being under, clavius meaning the clavicle. So what happens is that little muscle, if you look at the anatomy of the subclavius, it says that it's a depressor of the clavicle and or it elevates the first rib. And it can do both things. However, most anatomy texts, most anatomy resources that you look at forget one important function of the subclavius. Because what it does is when it attaches, attaches from the first rib underneath the clavicle, so when it contracts, it's an angled muscle or an oblique muscle, and when it contracts, it flips and rotates, it posteriorly rotates the clavicle. So if you take your right arm, this is Bucky's right side here, if you take your right forearm, imagine it's the clavicle. When that muscle contracts from underneath, it will rotate the clavicle, which will then rotate the scapula on the thorax. That's one of the big keys to getting the scapula to move into the right position. Now, obviously, you need other muscles besides the subclavius, like the serratus anterior, like the lower trapezius, like the upper trapezius, to help create that upward rotation and help to get the arm up and overhead. However, if that subclavius or that clavicle is being compressed down upon the rib cage, the subclavius can't rotate because there's too much compression. So take your left hand, let's all do the same side, put it underneath your clavicle on your right side. Now squeeze your shoulder blades down and back, and what do you feel happen? You feel the clavicle being compressed down upon the upper ribs. What you don't feel happening, or maybe you do feel it happening, is you are also compressing the intercostal spaces on that side, especially if this becomes a chronic strategy, and or think about now your client holding some dumbbells in their hand as if they're doing a farmer's carry or sort of carry type pattern, or if they're carrying their child in their hands, or a bag of groceries. So we want to think about those cues and what impact they're having on the shoulder, the clavicle, and those upper ribs. Because now the client, if their intercostals are also compressed underneath the shoulder being compressed, well, now you're not breathing up. They're not breathing up into that area. Well, your scapula also is supported upon the thorax, and it needs those intercostal spaces to be maintained so the scapula sits in the right place, so the serratus works the way it needs to. So just one simple cue of squeezing your shoulder blade down and back can disrupt optimal mechanics and disrupt optimal stability and breathing into the rib cage underneath that compression. So here's a very easy way to release the subclavius. Now, obviously, if you're a manual therapist, you can get in here and do some manual therapy with your fingers. You can teach your client, you can take Bucky, hey, take your left hand here, take the fingers, stick it underneath the clavicle, and then have Bucky, or your client, have your client breathe up and underneath their clavicle. And imagine or visualize their shoulder coming wide. We want to create more width through the shoulder. And that's one of the cues we use, is create more width through the shoulder so that the shoulder isn't being compressed down and into the body. And that's why so many of your clients, they have a very narrow shoulder look. They're not wide because they're being too compressed because of the pectoralis minor, because of the pecs in general, and or the lats that pull the scapula towards the midline of the body. So very easy to just do some breathing, do some focused visualization, and getting width across the upper clavicle. You can also use this handy dandy little tool from my friends over, my colleagues Dana and Rusty over at Rolga, the activator with a smooth edge. You can also have your client just take the activator, put it underneath the collarbone, do some light breathing into it. You don't need to dig and mush and mash and jump on top of it. Jump on top of it. You just take a smooth edge, put it underneath the clavicle, and just do some light breathing. Generally doing this in a supine position so the shoulder can relax and open. Then you obviously want to train it so that your client understands how to maintain that position and can create that upward rotation and posterior tilt. A wall plank is a very simple, easy pattern. You basically just have your client go on a wall in this position here. And you can do it from a side or oblique sort of position here, so that way you're teaching the client to maintain that upward rotation and posterior tilt. From behind, it looks like this. Very easy position to maintain for most of your clients, but you oftentimes need to decompress that shoulder to allow the client to get that posterior tilt, upward rotation, and posterior tilt. And then you want to train your clients not to squeeze down and back during the majority of their exercises. And if they need it for a specific exercise, like maybe they're doing a heavy bench press, heavy row, and or heavy carry, well then teach them to decompress that after the set so that they're not walking around the rest of the day and the next few days and for weeks and months with that compression. Because remember, your brain, your nervous system, it's only learning when you're teaching it. So if you're teaching it to compress down and back, that's what those muscles will learn how to do. So teach your client how to decompress their shoulder so that way they can restore more mobility to that clavicle, restore space between those upper ribs, and then have a better position for the scapula as well as the entire shoulder complex. And you'll help so many clients with chronic shoulder issues as well as chronic neck issues, because a lot of this compression in the shoulder also is what's driving their neck issue as well. I hope that made sense. I hope you enjoyed this video and sort of put together some of the things we've been discussing here on Integrative Movement Insider, because this Saturday starts part one of our three-part series on common orthopedic issues of the shoulders. I wrote a book, Corrective Exercise Solutions for Common Hip and Shoulder Dysfunction. I'm working on the second edition, hope to have it done here in the next couple weeks. And we're going to discuss in this brand new series of Two Anatomy Geeks, because so many of our clients are coming now with shoulder issues, long thoracic nerve issues, scapular winging. You know, we have clients that have had shoulder surgery, returning from surgery, still having issues after surgery. So we're going to discuss some of the common anatomy around the shoulder, including subclavius, serratus, and some of the other scapular stabilizers, so that way you understand how the shoulder functions, so then you can understand and explain to your clients why these things oftentimes, or I should say, why some of these muscles can contribute to suboptimal strategies. But more importantly, we want you to be able to take this information. We're going to teach you some assessments, some very simple, easy to institute assessments, very similar to what we just did here. Just figure out if your client's compressing their shoulder and then teach them how to decompress their shoulder. Very simple, just with some easy self-myofascial release. And breathing will show you more strategies in this three-part series, the next 3 Saturdays, this coming Saturday and the next 2 Saturdays. Jill and I, my fellow anatomy geek, Bucky, will be on the sideline for this one. However, we're going to share with you how to assess the shoulder, how to use corrective exercises, and how to progress your client, what exercises to avoid with your clients that have common issues of the biceps tendon, rotator cuff, labral issues. I'll share my own story about bilateral rotator cuff tears, bilateral labral tears, and the exercises that help me get over that sort of situation, and the things I can do and can't do, how to modify my exercises to continue to work out even with these issues and to avoid surgery, no medication. So we're going to share this information with you. Hope to have you join us in this brand new series. It's going to be a lot of fun. It's a really awesome, amazing community of like-minded individuals just like you, just looking to learn, just looking to expand their knowledge, build upon what they already do well, and support each other. It's really a supportive community, so we'd love to have you part of our community. It's next 3 Saturdays. We'll apply for CCs once the 3-part series is completed. $69 for about 5 to 6 hours worth of content. Lots of question and answer. All sessions are recorded, so it's a really great value. And more importantly, you're going to be able to help so many of your current clients. If you have chronic shoulder and or neck issues, you'll be able to help, or should say, help figure out some of the reasons why. And a lot of these reasons aren't being addressed in common sort of shoulder rehab type protocols. And more importantly, like I said, it's going to be a great community of individuals, or I should say, it's not going to be, it is. It's going to be great if you join us as well. So thanks so much for watching. Thanks for being part of our community here at Integrative Movement Insider. Love to see you at Two Anatomy Geeks this Saturday. Link is below this video or next to this video, wherever you're watching it. This is Dr. Evan Osar. Look forward to seeing you this Saturday and or on the recording. Make it a great day. Go out there and lead. Be that leader that your current clients and your potential clients are looking for. Take care.